So the axillary artery is the main arterial supply from which all arteries that supply the upper limb arise. So it is the axillary artery that gives rise to the arteries that supply the upper limb and even some parts of the thorax. Now, the axillary artery is a continuation of the subclavian artery. Remember that the subclavian artery comes directly from the aortic arch or from the brachiocephalic trunk. Now, that subclavian artery now continues as the axillary artery as it crosses the first rib. So the axillary artery is a continuation of the subclavian artery. It extends from the outer border of the first rib up to the lower border of the teres major muscle. So in the diagram, I'm going to show you the teres major muscle, and you will see that the axillary artery occupies the position close to the lower border of the teres major. So it begins from the outer border of the first rib, and then it ends at the close to the lower border of the teres major muscle. And then once it crosses the teres major muscle, it now continues as brachial artery. And then it runs, or it is closely related to the brachial plexus cords. So the brachial plexus is the nerve supply, the nerve network that supplies the upper limb, and these plexus has cord. So the cord of those plexus are closely related to the axillary artery. So you must not forget that the axillary artery runs alongside the cords of the brachial plexus. Now, this axillary artery is divided into three parts by a muscle called the pectoralis minor muscle. So the pectoralis minor muscle splits the artery into three parts, which we would see in another slide. So here you see your subclavian artery coming from the brachiocephalic trunk or from the aortic arch. And then once it crosses the first rib, it changes its name to the axillary artery. So here you have the axillary artery. And then we said that when it gets to the lower border of the teres minor, it ends there, and then it becomes the brachial artery. So here you will find the pectoralis minor muscle, this pectoralis minor muscle that divides the artery into the first part, which is between the first rib and the upper border of pectoralis minor. Then the second part is running superior to the pectoralis minor muscle. And then the third part is between the lower border of pectoralis minor and the upper border of teres major muscle. Now, we're going to see these three parts. And then once it crosses the teres major muscle, it becomes what we call the brachial artery. So this is the course of the axillary artery. Begin as subclavian, becomes axillary, divided into three parts by pectoralis minor, and then ends on the lower border of the teres major muscle. And then it continues as the brachial artery. So you see this name, brachial artery, that's why you also have brachial plexus, because the brachial plexus is coming to supply the upper limb or also. So in another diagram, you see that the cords of the brachial plexus are running alongside this axillary artery. So now, what are we said it's divided into three parts. So what are the parts of the axillary artery? So the first part has branches. Each part has branches. So the first part has one branch, which is called the superior thoracic artery. Remember, I told you that the axillary artery supplies not only the upper limb, but also supplies the thorax. So that is why you have the superior thoracic artery coming from the first part of the axillary artery. And then the second part of the axillary artery has two branches, which are Acromiothoracic Artery and the Lateral Thoracic Artery. So first part, superior thoracic artery. Second part gives rise to Acromiothoracic Artery and Lateral Thoracic Artery. So all of these are supplying the thorax, different parts of the thorax. Then the third part has these branches, Subscapular Artery, which is supplying part of the scapula. And then we have the Anterior Circumflex Humeral Artery, which is supplying part of the humerus. And then we have the Posterior Circumflex Humeral Artery, also supplying some part of the humerus. Okay, so look, this is the diagram here. Now, we have, this is our artery here, our axillary artery. From here down to this place is our axillary artery. So let's try to identify the branches. So here, you see this one coming here, superior thoracic artery, superior thoracic artery, from the first part of the axillary artery, superior thoracic artery. And then here, you see what is called the thoracoacromial trunk. So the thoracoacromial trunk is supplying both the thorax and the acromion. So that is this, if we come back to this slide, here you see acromiothoracic artery. So supplying both the acromion and the thorax. The acromiothoracic artery is from that trunk that we just saw now. So this is the trunk here. So it will give off a branch, which is called the acromial branch, and then another branch, which is called the deltoid branch. So this deltoid branch is going to supply the deltoid muscle, which is on top of the head of the humerus. And then also there is a lateral thoracic branch, which is not labeled in this. Yeah, okay, it's labeled. So it came down here. If you look at this place, you'll see a branch running behind this muscle, running behind the pectoralis minor muscle. This is it coming down, lateral thoracic. So it's supplying the lateral aspect of the thorax, the lateral aspect of the thorax. So this is the lateral thoracic artery. Now, if you notice, you see that this lateral thoracic artery originated from the second branch, the second part of the axillary artery, because we said the first part of the axillary artery is between the first rib. This is the clavicle. So it's the first rib is somewhere here. So it's between the first rib and the upper border of the pectoralis minor muscle. So this part here gave off this branch, and then the second part is a little bit below the pectoralis minor muscle. So this trunk, this whole trunk here, are the part of the second branches of the second part. So we have the thoracoacromial trunk, from which we have the acromial branch and the deltoid branch, and then we also have the lateral thoracic artery, which is coming down here. Then the third part, which we said is between this muscle, lower border of the pectoralis minor muscle, and the teres major muscle. So here you see the different branches. You see this branch here is anterior circumflex humeral artery. So this bone is the humerus. So this artery goes around this bone. So that's why the name is called circumflex. Yeah. So anterior circumflex humeral artery. So it runs across the anterior aspects of the humerus, while sorry, that's this one here. This is the artery here. This one is running anterior, running in front of the circumflex of the humerus. So that is called anterior circumflex humeral artery. So this one is the anterior circumflex humeral artery in front of the humerus, while at the back, this one coming here is running behind the humerus. So it came this way. So running behind the humerus, so it is called the posterior circumflex humeral artery. So we have anterior circumflex humeral artery running anterior to the humerus, and the posterior circumflex humeral artery running posterior to the humerus. But they are branches of the third part of the axillary artery, because the third part is from here to here, lower border of pectoralis minor down to the teres major muscle. So this whole part is the third part of the axillary artery. And then you see the subscapular artery also. So it gives off a subscapular artery. If we come back to the previous slide, you will see that we had said that the third part gives off subscapular artery, anterior circumflex humeral artery, and posterior circumflex humeral artery. So we have a kind of perfect arrangement. First part, one branch, second part, two branches, third part, three branches. Yeah, okay. So you must remember that the subscapular artery is part of the branch of the third part of the axillary artery. The anterior circumflex humeral artery is a branch of the third part of the axillary artery, and then the posterior circumflex humeral artery, which is also a third part of the third branch of the third part of the axillary artery. Okay, let's move to the next slide. And then, you know, once the artery crosses this lower border, as soon as it crosses the lower border of teres major muscle, the name, so this artery is no longer axillary artery. The name becomes what? Brachial artery. The name becomes brachial artery. Now, before you get this brachial artery, you see a deep branch here, which is called the Profunda brachial artery. The Profunda brachial artery, which is going deep behind the humerus. And then, so now this will be our brachial artery. Okay. So we can say that the axillary artery has a total of 6 branches. So first part, 1 branch, second part, 2 branches, and third part, 3 branches. And they supply the thorax, superior thoracic, acromiothoracic, lateral thoracic. They supply the scapula, and then they supply the humerus also. So here is another diagram that is explaining better the parts of the axillary artery. So this is the first part of the axillary artery, which we said is between the first rib and the pectoralis minor muscle, which is not shown here. And then the second part is between the pectoralis, runs below the pectoralis minor muscle. And then the third part is between the lower border of the pectoralis minor down to the teres major muscle. So these are the 3 parts of the artery. So let's try and identify the branches again that we mentioned before. So here, this first part of the artery, you see this branch, which is the superior thoracic artery, superior thoracic artery. Then here in the second part, you have the thoracoacromial branch, okay, or trunk, which is the thoracoacromial artery you see here. And then this thoracoacromial artery gives off several branches. So you have your acromial branch. So this one is your acromial branch going to the acromion, going to supply the acromion. Then you have your deltoid branch. So this is a deltoid branch which will go and supply the deltoid muscle. Deltoid muscle. Now, apart from that thoracoacromial branch, we also have what we call the pectoral branch, which will supply some of the pectoral muscles. Then this third part, let's identify first our lateral thoracic artery. Lateral thoracic artery. So it's supposed to be running. We can't see it here, but it's supposed to be running here. Maybe they didn't label it. So this is it, supplying the lateral part of the thorax. So lateral thoracic artery, this one. The labeling is not obvious here, but this is it. Now, then the third part, now we said we have the anterior circumflex humeral artery running in front of the humerus. And then we have the posterior circumflex humeral artery running behind the humerus. And then we have the subscapular artery, which is supplying some part of the scapula and the muscles attached to the scapula. Okay, so these are the main branches of the axillary artery. So the superior thoracic artery is a small branch of the axillary artery, and it is located between the pectoralis major and minor. It is between the pectoralis major and minor. So what does it supply? So it supplies the pectoralis major, pectoralis minor, and the thoracic wall. So if they say what are the what muscles or what is the distribution of the superior thoracic artery? The superior thoracic artery supplies the pectoralis major and minor, and then supply the thoracic wall also. From the name superior thoracic, you must remember that it supplies the thoracic wall, and then the muscles in the superior parts of the thoracic wall are the pectoralis major and the pectoralis minor. So it supplies those two muscles. And then the acromiothoracic artery is given at the upper border of the pectoralis minor, and it has 4 terminal branches. So that trunk, we saw that acromiothoracic trunk, it has 4 terminal branches, which are the pectoral branch, which I said supply the pectoral muscles as well as the breast. They supply the mammary gland and the pectoral muscles. And then we have the deltoid branch, which supplies the deltoid muscle, which is located on top or at the head of the humerus. And then we have the acromial branch, which joins the anastomosis over the acromial process. And then we have the clavicular branch, which supplies the sternoclavicular joints and the subclavius muscle. So the subclavius muscle, which is the muscle attached under the clavicle, subclavius muscle. And then the sternoclavicular joint, which is the joints between the sternum and the clavicle. So the point where the clavicle joins the sternum, the manubrium of the sternum, at that joint we'll have the clavicular branch of the acromiothoracic trunk, which is a part of the axillary artery supplying them. Okay, then we have the lateral Thoracic Artery. So it is given at the lower border of the pectoralis minor, which we saw in the previous slide. At the lower border of the pectoralis minor, that is where the lateral thoracic artery originates. Now, it is close to the anterior axillary lymph nodes. So the anterior axillary lymph node lies along this lateral thoracic artery. So anterior axillary lymph nodes lies along the lateral thoracic artery. It is larger in females and it supplies the mammary gland, the breast tissue. So two main arteries we've seen that supplies the mammary gland, the the pectoral branch of the acromiothoracic artery, and then the lateral thoracic artery, supplying the breast tissue, and the axillary lymph nodes, anterior axillary lymph nodes. Now, the subscapular artery is the largest branch of the axillary artery. The subscapular artery is the largest branch of the axillary. From the name, it runs along the lower border of the subscapularis muscle. So the subscapularis muscle, the muscle that is under the scapula, attached to the scapula inferiorly, it's called the subscapularis muscle. So that muscle is the subscapular artery runs along the lower border of this muscle, and then it terminates near the inferior angle of the scapula. The scapula has angles. The inferior or the lower angle of the scapula, the subscapular artery terminates there near the inferior angle of the scapula. And then it gives the circumflex scapular artery. Circumflex scapular artery. Again, circumflex, showing you that it's circular. It's going to go around the scapula. So it passes through the triangular intermuscular space, winds around the lateral border of the scapula, deep to the teres minor, and then it takes part in the anastomosis around the scapula. So there is an anastomosis around the scapula made up of different blood vessels. So the subscapular artery gives rise to this circumflex scapular artery, which is part of that anastomosis. And then the anterior circumflex humeral artery, which we said runs anteriorly to the humerus. It is given at the lower border of the subscapularis muscle. It winds around the surgical neck of the humerus. Now, if there is if somebody falls, for example, and there is trauma to the surgical neck of the humerus, the artery that will be affected will be the anterior circumflex humeral artery. Why? Because it winds around the surgical neck of the humerus. Anastomosis with the posterior circumflex humeral artery. So the circumflex artery from the front, anastomosis with the one from the back. So anterior circumflex humeral artery, anastomosis with the posterior circumflex humeral artery, which we saw in this diagram. Where is that diagram? Here. So you see these two arteries, anterior circumflex humeral artery, anastomosis with the posterior circumflex. So they both join together to form that anastomosis there. Okay. Now it is the ascending branch. It is the ascending branch of the axillary artery. Now, posterior circumflex humeral artery is larger than the anterior circumflex humeral artery. It runs backward through quadrangular space along with the axillary nerve. So posterior circumflex humeral artery runs posteriorly through the quadrangular space along with the axillary nerve. So it supplies the shoulder joints and the deltoid muscle. So anytime you hear shoulder joint, remember that the muscle, the main muscle there is the deltoid muscle. So let's look at the relations of the first part of the axillary artery. So what are the structures that are related to the first part of the axillary artery? So the skin the superficial fascia, the deep fascia, the clavicular part of the pectoralis major, the clavipectoral fascia with cephalic vein, lateral pectoral nerve, and thoracoacromial vessels. So these are the structures that are close or related to the first part of the axillary artery. So anteriorly, on the anterior side, we'll have the skin, the superficial fascia, the deep fascia, the clavicular part of the pectoralis major, clavipectoral fascia with cephalic vein, lateral pectoral nerve, and the thoracoacromial vessels. So this is just showing you the relations. So here you have the skin, right? And then you have the superficial fascia and the deep fascia. And then you see your pectoralis major muscle. You see your thoracoacromial artery, and then lateral pectoral nerve. And then here you see your axillary artery. So this is the axillary artery. So all these structures above it are the anterior relations of the axillary artery. The anterior relation, all the structures are the anterior relations of the axillary artery. Okay. Oh, let me show you the cephalic vein also. So here you see the cephalic vein. Cephalic vein. So all these are anterior to the artery, the first part of the axillary artery. Then posteriorly, what are the relations of the first part of the axillary artery? So you have the first intercostal space with the external intercostal muscle. And then you have the first and second digitations of the serratus anterior muscle with the nerve to the serratus anterior. And then you have the medial cord of the brachial plexus with its medial pectoral branch. So on the posterior aspect, the first part of the axillary artery is related to the first intercostal space with the external intercostal muscle, the first and second digitations of the serratus anterior muscle with the nerve to the serratus anterior, and then the medial cord of the brachial plexus with its medial pectoral branch. Let's see if we have that. So here, this is nerve to serratus anterior. So this is the serratus anterior muscle. This is the medial cord of the brachial plexus. And then this is the first intercostal space. So they are posterior to the axillary artery. So this is anterior. These ones are anterior relations of the axillary artery, and these are the posterior relations of the axillary artery. Now let's see the lateral relation. So lateral and posterior cords of the brachial plexus. Lateral and posterior cords of the brachial plexus are on the lateral or lateral to the axillary artery. And then medially, we'll have the axillary vein. The axillary vein is a medial relation of the first part of the axillary artery. And the first part of the axillary artery is enclosed together with the brachial plexus in the axillary sheath derived from the prevertebral layer of deep cervical fascia. So remember that the axillary artery is running alongside the brachial plexus in what we call the axillary sheath. So an injury to the axillary artery would most likely also lead to an injury in some part of the brachial plexus, the cords of the brachial plexus, which we said run alongside the axillary artery. So when you see a patient that has injury to the cord of the brachial plexus, there is a high possibility that that patient will also have an injury to the axillary artery, because both the axillary artery and the brachial and the cord of the brachial plexus run together in the same sheath. So let's see if we can identify the lateral and the medial. Okay, so here you find the medial pectoral nerve here, And then on the medial side, then on the lateral side, you see the lateral cord and the posterior cord of the brachial plexus. So these two are lateral to the axillary artery. While this medial cord this medial pectoral nerve and the medial cord are a little bit medial to the axillary artery. So remember this, all structures anterior to it are the anterior relations. The structures lateral to it are the lateral relations. The ones medial to it are the medial relations. And then the ones posterior to it are the posterior relations. So here you can find that this axillary vein and this medial pectoral nerve are medial to the axillary artery. So that is the medial relations of the axillary artery. Okay, so axillary vein, you would see. Now, relations of the second part of the axillary artery. So what we did was the first part of the axillary artery, which we said is between the first rib and the pectoralis minor, upper border of pectoralis minor. So all these relations we saw now are between that first rib and the upper border of the pectoralis minor muscle. Now, the second part of the axillary artery, which runs below the pectoralis minor muscle. So what are the relations of the second part? Anteriorly, we have the skin, superficial fascia, deep fascia, the pectoralis major muscle, and the pectoralis minor. If you don't remember anything about the relations, remember skin, superficial fascia, and deep fascia. Don't forget them. When you're talking about the anterior relations of the artery, the skin, superficial fascia, deep fascia, you must not forget. Then since we say that the second part of the axillary artery is running under the pectoralis minor muscle, so you should expect that the pectoralis minor will also be an anterior relation of the second part, and of course the pectoralis major also, which is kind of above the pectoralis minor and bigger than it. So let's see. So here, this is our axillary artery, second part of the axillary artery this time. So the anterior relation are skin, superficial fascia, deep fascia, pectoralis major, and pectoralis minor. All these are the anterior relations of the second part of the axillary artery. Now, without even going to read the slide, we can see the lateral. Okay, let's take the posterior relations first. The posterior relations will be the posterior cord of the brachial plexus and the subscapularis muscle are the posterior relations of the second part of the axillary artery. Now, what are the medial relations? Medially, the relations are the medial pectoral nerve, the axillary vein, and the medial cord of the brachial plexus are the medial relations of the second part of the axillary artery. Then the lateral relations are the lateral cord of the brachial plexus, the short head of the biceps brachii muscle, short head of biceps brachii muscle, and the coracobrachialis muscle. So coracobrachialis, short head of biceps brachii, and the lateral cord are the lateral relations of the brachial plexus. So if you can't remember anything, know that posterior cord of brachial plexus is posterior to the axillary artery. Lateral cord of the lateral of the brachial plexus is a lateral relation of the axillary artery, while the medial cord of the brachial plexus is a medial relation of the axillary artery, second part of the axillary artery. So don't forget that. Okay, so let's look at the posterior relation. So posteriorly, we have the posterior cord of the brachial plexus and the subscapularis muscle. Medially, we have the medial cord of the brachial plexus, the medial pectoral nerve, and the axillary vein. And then laterally, we have the lateral cord of the brachial plexus. But 1 minute. So we also have not only the lateral cord, we also have the short head of the biceps and the coracobrachialis on the lateral aspect. So relations of the third part. Now, the third part of the axillary artery, we said, is below, is from the lower border of the pectoralis minor down to the lower border of the teres major muscle. So what are the anterior relations? Again, skin, superficial fascia, deep fascia. And then in the upper part, there are the pectoralis major and medial roots of the median nerve. And then posteriorly, we'll have the radial nerve. We'll have the axillary nerve in the upper part. We'll have the subscapularis in the upper part, and then the tendons of the latissimus dorsi and teres major in the lower part. So if you cannot remember anything, know that teres major will be part of the relation, because we already mentioned that the third part of the axillary artery runs from the lower border of the pectoralis minor to the lower border of the teres major muscle. So you should expect the teres major to be a part of the relations. Now, so here we come, third part of axillary artery. So what are the anterior relations? Here you see the medial root of the median nerve, your pectoralis major muscle, your deep fascia, your superficial fascia, and your skin. So it's always good to name it from skin down. So anterior relations of the third part will have the skin, superficial fascia, deep fascia, pectoralis major, and medial root of median nerve. All these are anterior to the third part of the axillary artery. And then the posterior relations, we have the axillary nerve, the radial nerve. So these two arteries run posterior, to the humerus. And then you have your subscapularis muscle. So these are the posterior relations of the third part of the axillary artery. Now, what are the medial relations? Again, medial cutaneous nerve of forearm, the ulnar nerve, and the medial cutaneous nerve of arm. Medial cutaneous nerve of forearm, medial cutaneous nerve of arm, and the ulnar nerve make up the medial relations of the third part of the axillary artery. Lateral relations will have the lateral roots of median nerve. So median nerve has two roots, lateral roots and medial roots. So the lateral root forms a lateral relation to the third part of the axillary artery. You have your coracobrachialis muscle, and then you have your musculocutaneous nerve as the lateral relation of the third part of the axillary artery. 1 minute. Okay, so here you have a bigger picture which is showing relations of the third part of the axillary artery, the lower part of it. So you have your teres major, latissimus dorsi. Posteriorly, you have your deep fascia, superficial fascia, and skin. Anteriorly, and then you have your medial cutaneous nerve of forearm, axillary vein, and ulnar nerve medially, and then you have your radial nerve, coracobrachialis, and medial nerve, lateral roots of medial nerve. You have laterally. So let's see what we have. Laterally, coracobrachialis, which we saw in the diagram, the musculocutaneous nerve in the upper part, the lateral root of median nerve in the upper part, the trunk of the median nerve in the lower part. So on medial aspect, we have the axillary vein, the medial cutaneous nerve of the forearm and ulnar nerve, and then the medial cutaneous nerve of arm. So applied anatomy. The axial artery pulsation can be felt against the lower part of the lateral wall of the axilla. So if you want to feel the pulse of the axillary artery, you press the artery against the lower part of the lateral wall of the axilla. So your axilla is your armpit, yeah? So on the lateral, the outer parts, so you have the lateral wall of the axilla. If you press it, you can feel the pulse of the axillary artery in the lower part of the lateral wall of your axilla. Now, in order to check bleeding from the distal part of the limb, what you do is that the artery can be compressed. Imagine that there is bleeding from the distal part of your limb. See what will happen. So the artery can be compressed against the humerus in the lower part of the lateral wall of axilla. So imagine that there is bleeding from your, let's say there is bleeding from your cubital fossa, yeah? There's bleeding from your cubital fossa. So blood is gushing out, but you want to stop that blood from gushing out. What you do, you press that axillary artery, because it is the axillary artery that gives rise to the brachial artery. All other arteries, once you are able to block the axillary artery, you block blood supply. So you stop the bleeding. So a way to stop the bleeding is to press on the axillary artery, press the artery against the humerus in the lateral wall. So by so doing, you stop excessive blood loss. Okay, so here you have a few questions. Let's try and see if we can answer these questions. So the question says, the axillary artery is a continuation of which artery? The axillary artery is the continuation of which artery? A, supraclavicular artery. B, subclavian artery. C, subscapular artery. D, superior thoracic artery. What do you think is the answer?
Subclavian artery.
Subclavian artery. Which structure divides the artery into three parts? A, pectoralis major muscle. B, clavipectoral fascia. C, pectoralis minor muscle. D, teres minor muscle.
Pectoralis major muscle.
Major or minor? Minor.
That divides it into three parts.
Into three parts. Minor. Okay. Which is the second branch? Which is the branch from second part of axillary artery? A, acromiothoracic. B, lateral thoracic. C, none of the above. D, both of the above.
Acromiothoracic artery.
Are you sure it's only acromiothoracic artery?
The second part of the.
Yeah, so I'm going to take you back to the diagram again. Take you back to the diagram. So where is the diagram? Okay. So the picture we saw. Okay, so we saw this picture, yeah?
Yes, sir.
So in this picture, we saw the thoracoacromial artery, yeah? And we also saw the lateral thoracic. So it's not just the thoracoacromial, also lateral thoracic come from the second part. Why the third part gives subscapular, anterior circumflex, and posterior circumflex, okay? So the answer should be both of the above. Both of the above. Okay. Okay, which is not true. Pectoralis minor and major lies anterior to axillary artery. Axillary vein lies medial to axillary artery. Subscapularis muscle lies lateral to axillary artery. Radial nerve and axillary nerve lies posterior to axillary artery.
Which of these is often not true?
It's not true. Pectoralis minor and major lies anterior to axillary artery. So when we're doing anterior relations of the artery, was pectoralis minor and major lying anterior to the artery? Is the axillary vein lying medial to the axillary artery? is the subscapularis muscle lying lateral to the axillary artery, and the radial nerve and axillary nerve lying posterior to the axillary artery. So this would be, okay, you want to try? Or this will be your homework. So take a picture.
D is correct. D is correct.
D is correct, okay.
Yes, D is correct.
Okay.
And then
so let me take you back to the diagram again. Okay. So medially, axillary vein is medial, yeah? To the axillary artery. Then let me take you back again. There was a picture that was showing the artery and the muscle here. So this is the muscle here. So the axillary artery is this muscle anterior to the axillary artery or posterior to the axillary artery, because this is pectoralis minor muscle. Is it anterior to the artery or posterior to the artery? So you saw that in the question too. Yeah. And then your we also saw a question about subscapularis. Yeah. Subscapularis. So is subscapularis running anterior to the axillary artery or running posterior to it? So let's go back. Or subscapularis lying lateral to it. Okay, so you take this as your homework. So take a picture of it, find out the answer, and you tell me in the next lesson. Okay. The largest branch of the axillary artery is the subscapular artery, the posterior circumflex humeral artery, the Acromiothoracic artery, and the brachial artery. The largest branch of the axillary artery. So I showed you in this slide. Yeah.
subscapular.
Subscapular. Are you sure about that? So I showed you in this. Remember that there is a trunk, yeah? There is one that is a trunk. So, okay. Largest branch is the subscapular artery. So even though we have the thoracoacromial trunk, is not as large as the subscapular artery. Okay. Let's see the last. Okay, that's the last question. Okay, good. So that will be all for today. Thank you so much.
Thank you, sir.
Yeah, see you. Bye-bye.
Yes, sir.